If you ask patients, what is the first one thing that you want out of your healthcare system? They'll say, I want everyone to talk to each other, right? And this is so important that we build that right off the bat as our culture. And I think that can truly set us up for success.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest today. Dr. Shah, can you please introduce yourself and your current role?
Thank you so much, Cole, for the opportunity. My name is Mayank Shah. I serve as the Vice President and Chief Medical Officer for Advocate Condell Medical Center. It's a community-based hospital that's in the Libertyville, Illinois area, so north of Chicago. We are about a 275-bed hospital, a level 1 trauma center, the only one in the Lake County area in Illinois, and very, very busy place for sure.
So when you say the only one in the area, how far is the next level 1 trauma center?
About 18 miles.
Okay, so that's a ways in that area for traffic and everything.
That's to the south of us, and to the north of us, we are about 40 miles away from the nearest, including crossing over to the Wisconsin border. So
Wow.
we have a pretty broad geography that we cover within the Lake County that our level 1 trauma center covers.
So that means that you see a lot of kind of urgency going on in your ED. This is not a low utilized ED, from what I'm assuming.
Oh no, it is not low utilized at all. Our ED is always extremely busy, and the hospital as well. We have had average occupancies of anywhere from 260 to 280 on a regular basis over the last several months. So I think it's a very busy place. There's a huge need for service in the community. And the cool thing about Lake County is that there is such a diversity of different communities that exist within the area. And so I think serving that patient population in that community has been one of the biggest privilege as well as a challenge for Condell.
One of the questions I have for you is because you've been there about a year or so, right? So was this post the acquisition or post kind of the series of mergers that they went in with Advocate, or were you still kind of coming in at the tail end of that?
My journey has been fairly interesting because I trained within the Advocate system. So I was at Advocate Lutheran General Hospital. That's where I did my training. And then I stayed on as faculty for about 11 years. Then I jumped ship and went to a different healthcare system, to a Catholic non-for-profit healthcare system in the Illinois market at the time. Then I adventured out into the payer world, and I was part of Cigna and then Centene for a while, and then I came back to Advocate. So I'll say that I've been with Advocate through multiple journeys and multiple mergers and acquisitions. Most recently, when I joined Condell, it was after the merger with Atrium in the Southeast, and after it had developed a national footprint beyond the Midwest region. And so, yes, I was part of a lot of that synergy and transitions that occurred through that transition process.
What are the challenges that you're facing kind of post transition? I've spoken with a lot of people at Advocate kind of from an enterprise level, and they say that one of their biggest challenges is that it's geographically spread out. And so we have to think about like weird IT scenarios. I was speaking with one of them, and they were saying that they're trying to figure out connectivity between a campus, all the way in Charlotte or Georgia with Chicago, and how sometimes the internet speeds or internet, lines will go down, and all these like different problems. But what are you facing kind of local to where you're at?
So I think, thinking from an enterprise mind frame, I'll tell you that cybersecurity over the last couple of years has been on the top of mind of every healthcare system in the country. And absolutely what you're referring to, the undercurrent of all of those discussions has been, how do we create more cybersecure environment when it comes to healthcare? And so that has definitely been part of the consideration. I think one of the key challenges when healthcare systems come together is that we have our own technology infrastructure that we have built over the years. And as you merge, how do you align? How do you create communication pathways? And how do you share best practices and instances so that there's uniformity in the care delivery. So I'll give you an example. When Advocate Health, which is the Illinois part, merged with the Wisconsin Aurora Healthcare, existed on two different servers, and it took us almost 3 years to technologically integrate so that we can share information across the board. Luckily, this time, we've learned our lessons through that transition and acquisition process. We absolutely learned how to expedite and how to integrate far better than what we did in the past. But I think those are some challenges that we continuously have in the market to really think about. How do we first of all, think of more integrated process so that we could all benefit as a system from some of the changes, interventions that we're making. We can also learn from each other on the best practices, and then we can also share resources across the state lines. And I think those are some challenges that we continue to work through as we integrate more effectively and efficiently.
Just kind of like the next question I had was, there's a lot of CMOs at this point within the system because there's so many hospitals, and even with hospital consolidation, we still need a lot of hospitals, and then therefore a lot of CMOs. And you're overseeing, like we had mentioned before we got started, 1,400 people. That's a lot of people and a lot of patients. What does the collaboration look like between CMOs and hospital leaders in Charlotte, for example, or in Georgia? I think it's in Macon is where the other Atrium campus
Right.
is. And then also in Wisconsin, in Illinois. Do you all know each other yet? Are you still meeting each other? What does that look like?
Great question. And I think part of this is what we had originally set up as a region. So initially, when we came together with the Southeast, just because of this integration effort of bringing everything together, Advocate Health was already on a journey with integration with the Wisconsin market. So it was very easy to think of us as two distinct regions: the Midwest region, which included Illinois, Wisconsin, some sites in Michigan, and then our Southeast partners. And so those were the two geographic regions that were divided. And then we had leadership teams within each of the departments. And I think initial learning part of the integration was really learning about the leadership in each of those areas, coming together, learning about our best practices, and then also strategically thinking about how do we collaborate with each other in a way to bring programs and patient care models that are more aligned with what the market is doing, and how can we redefine care, which is kind of the value and mission of what Advocate is set out to do in the next few years. And so I think really the structures were already set up. And so in the Midwest region, the CMOs have a regular meeting where we all come together. We talk about issues, concerns, as well as strategic approaches to tackling our market, as well as some of the key outcomes in the markets. Again, focusing on quality and safety for the patients and communities that we serve. And then learning that from the Southeast has been, what are some of the challenges we have, and then how do we collaborate across the borders to the Southeast to learn what have they done in the past, what are some best practices, and then vice versa, sharing some of ours along the way so that we can now continue to drive those best practices locally.
As a physician with experience kind of geographically across different markets, one of the questions I have is, are the conditions you're treating, and also I'm thinking about like comorbidities, different in different markets? And is that why we need to think about how to kind of segment while also tying together at the same time?
Oh, absolutely. So, even though the medical conditions may be the same across the board and across the country, and I even know this from my previous work at, being in various markets across the country, heart failure looks and presents the same way in Illinois, Wisconsin, Georgia, North Carolina. However, the contributors to that heart failure may be very different in each of the markets. The challenges that our patients with heart failure face may be very different in each one of those markets, in each of the local areas. I can tell you there's variation even in the state of Illinois. If you live in Cook County and if you live in the south side of Chicago, there's extremely different challenges than up north, where Condell is located. So I think and we know now in healthcare that about 80% of your health outcome is a result of what we call social determinants of health. So not directly related to your genetics, not directly related to your condition or care that you get, but everything around it, right? Well, are you lonely? Do you have financial security? Do you have food security? Do you have housing? All of those things contribute to your health outcome. And those nuances of those determinants are very local to the environment where you live. And so this is where the variation comes in. So yes, we could have a standard way that we manage heart failure, and you have organizations like Kaiser that are really doing a great job of that, where they're standardizing their approach across. No matter where you go in Kaiser, you're going to get the same level of clinical care. But despite that, you see various different outcomes in different markets. And the reason for that different outcome is really the social determinants of health. So what Advocate Condell and what Advocate Health is committed to doing is not only looking at the clinical outcome and the clinical care, but we're redefining care to look at how do we incorporate more thoughtfulness and strategy around social determinants of health. Our ultimate goal is to get to the highest quality outcome and the safest outcome we can get for all of our patients. But it's not going to just be around standardizing clinical care. It's truly paying attention to those social determinants and all of the other caveats that go with that health care outcome. Family support, dynamics, community support, all of that is so integral to the success of the outcome in a healthcare recovery. And so, how do we pay more attention to that? How do we build systems and infrastructures to really drive that? Is the key objective that Advocate's taken on.
I think that's a really important point because we need this. Or I'm actually doing a research project right now at the university for this. Is economy of scales helping? And we know that a lot of time it's helping the financial bottom line, and a lot of times it is improving quality metrics as a whole. But I think we need that approach where we're standardizing the quality of our care, and we're standardizing, our finances, so that we're able to potentially help different parts of the country, different parts of even our city that weren't able to get help before. But that's really important that we keep track of those kind of cultural differences, especially in preventative care, I feel like,
Yeah.
because I know from my experience, I went to college out in Charlotte for a little bit. Now I live in Philly. The types of fast food that are available are different. The types of urban environment is also different. In Charlotte, it's kind of a downtown that you drive to for events. You usually drive to a hospital. Here in Philly, if you're going to go to a hospital, usually you're going to want to take transit, or you're going to, I see people using Ubers for ambulances quite frequently. And so it's a different environment, and then that's going to be different conditions. That's so, so important. But one of the challenges I have on that is what work is required on your part as a CMO to make sure that your population is being cared for, especially since you have lived in different geographic areas, you've been exposed to different geographic areas. What are you doing to make sure that your care at the hospital is being tailored towards that population?
A great question again, and I think the role of a CMO has changed drastically over the last decade, and I can tell you that having lived through this experience in various organizations and having really had different roles throughout and different models of care. In the past, I can say that there was a significant clinical focus that the CMOs had. We had accountability for the clinical care delivery part and clinical outcomes. I don't think that's the case anymore. I don't think we can work in a silo just to focus on the clinical care, ignoring the financial aspect, ignoring the social aspect of care delivery, the community engagement and collaboration, and creating that team-based approach. I think culture, as you know, has become an integral part of success of any organization. And specifically in healthcare, I think having the right culture is so important to driving your strategy and driving that optimized outcome. Having CMOs pay attention to the culture in the organization is absolutely important. It's a critical skill that allows for a successful outcome at the end of the day. So that is one skill that I think is critically important as a CMO that in the past we probably didn't get trained or didn't really focus so much on. Second is really thinking outside of the box. I think we are so much solution oriented as providers, as physicians, that you're constantly focusing on coming up with how do I treat this the best way possible? What can I do? What tools do I have available? But also thinking about when I don't have any tools, how would I think about this differently? And even when I have tools at my disposal, what happens when those tools run out? When I don't have resources to be able to sustain and afford that? And I think that type of thinking is what will allow us to move forward in healthcare. In the past, I'll give you an example. Whenever we had a patient with severe illness, our idea was, let's throw in as many consults as we can. Let's throw in as many medications as we can at them to see if we can get them better. We see if we can improve their quality of life. That is not a sustainable long-term solution, right? But what else do we need to do to provide that holistic care? To your point, if the issue is you're living in North Carolina and you don't have access to fresh food, and now I'm going to have you manage diabetes and teach you all about fresh food, that effort is fruitless, right? You don't have access to that. What are you going to do with that information? You're not going to impact the outcome. So, how do I think strategically and create and innovate in this space to help you achieve success with the goals that I need to set with you together? And that's the level of thinking that I think we need to evolve into. Whether you're a CMO, whether you're at frontline delivering care, I think thinking outside of the box is more and more of the requirement in healthcare today than it has ever been in the past. In the past, we were focused on the medical knowledge expanding so quickly, keeping up with that medical information. How do I have the right treatment protocols, the right treatment opportunities, and making sure that I'm delivering the right clinical outcome? Now it's more about, is my care comprehensive? Am I thinking holistically about the care model? And what else could impact the outcome here that I'm not thinking through?
It's important that you mentioned that as well. It's not like everybody was sitting on their hands for the past 100 years, right? Everybody was extremely busy for the past 100 years, but the issue is that 100 years ago, penicillin was just
Yes.
be gaining further, right? So we were kind of living in pretty dark times. I have a great book I like to leave out, and it's kind of a photo history of surgery, and it covers all paintings of all these different surgeries, and people are often surprised at kind of how brutalist some things looked
Yeah.
even as early as the 1900s, right? So
Yeah.
now that has changed a lot, like you said, the focus is changing. But here's where, I know the time is running short, so I'll ask you kind of for one of your last pieces of advice, but it's a hard one, and it's that sometimes when we are working for an organization as an employee and we're told we don't have the resources that we used to have, so we need to come up with innovative ways, it can kind of just be like, wow, I'm just being given more work. And I've seen some team members, including myself, sometimes just resign ourselves to the situation and get discouraged and say, well, if they don't want to give us the resources, then that's their
How am I
problem.
supposed to do this? Yeah.
Right, exactly. And so like I said, I sympathize with that because I've been there. There's the other side of the coin, which is you don't want to drive people too hard where they're burning out or they're discouraged, on the other side of things. And so, how do you have any tips on how we can manage that middle ground where our employees are motivated to innovate, they feel safe to innovate, but they're not burnt out?
Yeah. This is an issue in healthcare that we're all struggling with these days, right? And as much as we'd love to have unlimited resources, the reality is that we are going to face a challenge in the next decade, in the next 2 decades, where we're not going to have unlimited resources to throw at our patients and to take care of the communities. We have an aging population. We have enormous tax on our healthcare system already. There's a provider shortages in multiple specialties. And so, how do we manage that going forward and not make people burn out and at the same time take care of the needs of the community? My advice is twofold. First and foremost, I think it's really important that we have our own sense of purpose, right? And we just talked about this as a team. I think a lot of times we get so focused on metrics and outcomes, like we say, oh my God, I got to achieve this success with readmission rate, or I got to get this number down. We forget the process in itself, right? We measure our success based on the outcomes of those metrics. That is not our true success. The true success is the effort that we put behind those metrics. What was our thinking? What innovation did we come up with? Did we think outside of the box? Did we come up with new ideas and new opportunities? Did we come up with a new vision, right? All of those nuances really contribute to that culture of healthcare that I was speaking about earlier. And I think that is the true success in healthcare. And I think if we can capture that, we'll have great success in thinking through and not getting burned out through this process. It's truly about what can I do with what I have. The condition right now and the situation right now is preparing us really well for the future when we are going to have limited resources and we're going to have to think outside the box. But if we train our mind to think this way, we'll get reward out of the process itself rather than the end outcome. And the end outcome will automatically come our way. And I think it'll come out our way in a very smart way, because not only will we get the outcome, but we'll get it in a cost effective way that doesn't burden our economy. So,
And it'll be sustainable for future generations, right? Which is where we're not
absolutely.
at right now.
Absolutely. And that should be our goal to think about, is not just how do I fix this now, but how do I sustain this for generations to come.
Can you give us maybe a first step that fellow CMOs can take? And I think maybe on a smaller end as well, maybe a less resourced end already, because I know what some people say at rural hospitals is, when I talk to them, is they're like, I'm already so under resourced. You want me to look at ways to use less resources, but what is a first step that they can take if they're watching this right now? They're planning out, for 2025, what initiatives they're going to take on. What would be the first thing?
First and foremost thing that I'll say, and I've done this in every single role I've had as a CMO, is understand your market, understand every nuances of the population, the community that you serve, and the resources that you have available. Oftentimes, when we think about resources, we're thinking about our immediate workspace. We're thinking about my hospital, my community, but there are resources beyond that that can help us tap into some of the creative ways to think through this issue. There are foundation and fundraising opportunities that may get us over a hump, when, especially when we're stuck. There may be philanthropic efforts that we can make. There may be alliances that you can create. A lot of times we think of competition as someone we can't share anything with. I'll give you a great example. We had an IV fluid shortage recently, with the Baxter plant getting flooded in North Carolina. I'm sure everyone got affected by that. Our first step that we took is we came together with our competitors in the market and we said, how do we solve this together? And we came up with some great ideas together on how we can leverage each other, our skills, our experience, to really bring those solutions together to take care of the community that we serve. Now, had we stayed in a competitive mode, we probably wouldn't have accomplished that together, right?
Hmm.
But I think this is where we need to look beyond. This is what I mean about thinking about your and studying your market in a deep way, so that you know what your resources are, you know who your collaborators are, and don't ever be afraid to reach out and ask for that collaboration. Take that step to collaborate, and I think there's a tremendous opportunity for us to do that in healthcare.
I have seen firsthand, and you've seen it probably many more times than me, that those who share and work together, I mean, just like your example just now, they usually succeed, and those who don't sometimes do succeed still, but usually it's much more costly, and it harms reputation. Nobody in the public wants to see hospitals competing. That is a
Exactly.
figment of our maybe our imaginations a little bit, right? So
You are
they want
so
to see
right.
us partnering.
That's right. When people are putting their lives in your hand, they really want us to see more collaborative. Like if you ask patients, what is the first one thing that you want out of your healthcare system? They'll say, I want everyone to talk to each other, right?
Yeah.
And this is so important that we build that right off the bat as our culture. And I think that can truly set us up for success.
Thank you so much, Dr. Shaw. That's an awesome place to leave off on. So I'll end it there, but I hope we can have you back on again in the future.
I would love to be part of this. And thank you so much, Cole, for giving me this opportunity to talk.